For this lab, you'll be taking a look at the pelvic limb. So we've already done the proximal pelvic limb, but we're looking at more of the middle of the pelvic limb. So here we can see the medial side of the pony limb, and again you can leave the bag on the front end so you don't have to rewrap your whole specimen, just the hind end. And once you are on this side, you want to take a medial incision all the way down. So you've already done the top part here, so that should kind of be flapping open like that. So you want to take this all the way down, this medial incision all the way down to the cannon bone and go around the cannon bone and then take off all of that skin. Just all of it can come off and you can discard it. So one big piece. And now we'll take a look at the lateral side of the right limb. So here we have a look at the lateral side of the right pelvic limb. And you've already done these proximal muscles here in the rump, so you should have already reflected all of these, your biceps femoris, your semimembranosus, semitendinosus, and those should kind of be down like that. You also have your gluteals here that you've dissected, so those should be kind of reflected as well so that you can get a good look in this area. So what we want to see here is the tensor fascia lata muscle here. We already saw that a little bit in the other lab, but it's attached to the fascia lata. So this fascial sheet right here is the fascia lata. Tensor fascia lata muscle can be transected across the fascia lata on the right side on the attached limb, and you can just reflect that cranially like that, and it should give you a really nice view of your quadriceps muscle group here. So we'll take a look at your quadriceps here on the right side. It will be a little more difficult to dissect these on the attached limb than it is on the detached left limb. So just do the best you can. But here you can see this big mass is all quadriceps, and we have the different heads that we need to identify. So if you remember the analogy of the hot dog in a bun, that's what we are looking at here as well, just like in the dog. So here you would have the Vastus Lateralis, so this one right here. So this big thick piece is Vastus Lateralis. So that would be the lateral side of your hot dog bun. Then in the middle here, you have the hot dog, obviously inside the bun. So this would be rectus femoris. Then what you can't really see very well from this angle is the medial side of the bun, which is Vastus medialis, but we'll take a look at that on the medial side when we do that. And then the bottom of the bun is Vastus intermedius. So that's down at the bottom underneath rectus femoris. So I have my fingers elevating rectus femoris, and the probe is sitting on top of Vastus intermedius. So hopefully you can distinguish most of those parts here in your quadriceps. If you need to, you can transect your rectus femoris across the whole muscle belly and then reflect it to see that Vastus intermedius, but it's not absolutely necessary. Another thing you want to do on this right side, the attached limb, you want to actually cut through. So you've already done these gluteals. So you've got middle gluteal and accessory gluteal. And you want to take a cut right across your deep gluteal and just reflect this cranial edge of it. And if you lift that up, you can see that this rectus femoris muscle belly attaches to the pelvis. All of the other heads of quadriceps, the vastus heads, attach on the femur, but rectus femoris is the one that goes to the pelvis. So you want to try and see that. And then also in this field of view, you can see the iliopsoas muscle. So right here is the iliopsoas muscle from the lateral side. So now we'll take a look at the medial side of this right limb. So here you have a view of the medial aspect of that right limb. So we're on the medial side now. This is caudal here, and this is medial here. So we want to take a look at this nice flat gracilis muscle. So gracilis needs to be transected and reflected distally. So try not to cut through the attachments of the fascia, but come proximally on the limb and then cut as far as you can close to the body wall and then reflect gracilis distally. So it's this big flat muscle. It's thicker than you think it might be, but that's gracilis. So then underneath gracilis, here you can see a muscle that we've already identified. That's the semimembranosus muscle. But that is right next to the adductor muscle. So adductor in ungulates is relatively small as compared to the dog where we saw the really big, thick adductor muscles. But in the ungulates, it's not quite as big and thick. So it's just from there to there is adductor in this pony. So gracilis, semimembranosus, adductor, And then when you move cranially, you'll have sartorius. So this muscle right here, this kind of strap coming down, is sartorius muscle. If you need to, you can also transect sartorius. I didn't here just because I think it helps give you a little bit more orientation. So the next couple of things are maybe going to be a little bit difficult to see, but I'll do my best to try and point them out. So on the attached limb, it's actually going to be helpful if you have a partner that lifts the limb a little bit for you as you're trying to dissect in this area. So you're going just cranial to your adductor muscle, and you're looking for the distal part of the pectineus muscle. So here the probe is pointing to pectineus, which hopefully you can see a little bit of. And then just cranial to that, you have the femoral triangle, the area of the femoral triangle here, in between pectineus and sartorius. You may be able to find some deep inguinal lymph nodes in this area, but they are pretty hard to find sometimes, but they're in some fat that's there. So you also want to dig down in between those two muscles and try to see the femoral vessels. So you have a femoral artery and a femoral vein. So I'm trying to elevate them with the probe there, and hopefully you can see them. They do have some nice injection on this specimen, and the artery is nice and pink, so the femoral artery, and the femoral vein is blue. So you can see that in that femoral triangle space in between that pectineus muscle and the sartorius muscle. So now we'll take a look at the stifle region on this right limb. So now we're on the cranial aspect of this right limb, and we're going to take a look at the stifle region. So the stifle region is the knee joint, and that's going to be right here. And basically what you want to do is identify the patellar ligaments. So there will be 3 of those, and you can see them nicely demarcated here. They won't look like that right away in your specimen. There's a lot of fat and tissue and fascia that covers this whole area. So you just have to carefully kind of find the edges and then peel away the fat to see where those are so that you don't end up cutting through them. But the patellar ligaments are basically named for their location. So you do have a lateral patellar ligament, so we're on the lateral side. So lateral patellar ligament. You have a medial patellar ligament over here. And then a middle that's in between those two. So a middle patellar ligament right there. So those 3 are just patellar ligaments. So try and find the edges of those before you make your cut. And your cut will actually be to free the patella itself. So these patellar ligaments are attaching to the patella and then to the tibial tuberosity. And so you want to make your cut above the patella. So you're cutting all the way through the quadriceps muscle mass. And you're actually going to reflect the whole patella down, but don't cut through those 3 patellar ligaments. You want to keep those intact and just reflect everything distally. So that way we can open up that stifle joint. So here you can actually see the patella, the bone there, where those patellar ligaments are attached. And here you can see I've cut all the way through my quadriceps muscle, and then I've cut on either side. So I've cut on the lateral side of the lateral patellar ligament, and I've cut on the medial side of the medial patellar ligament, and then reflected the whole thing distally. So do that, and then you'll be able to see inside your knee joint here, and you'll have to remove more fat in here, and there's a lot of fat in there. But one thing I want to point out before we do our cruciates is the lateral collateral ligament. So I'll try and get the probe under it so you can see it there. So that is the lateral collateral ligament of the stifle joint. So you want to find that on the lateral side. And then on the medial side, let me just find it first. There we go. The medial collateral ligament of the stifle joint is on the medial side, so try and find that. And then what you want to do is try and bend your limb. So having another person help you with this, and just bend it as much as you can so that you can try and see inside the stifle joint. And so right here you can actually see one of the cruciates is attaching cranially on the tibia. So that is the cranial cruciate ligament. So the cruciates are named for where they insert on the tibia, and here you can see the cranial cruciate coming through here and attaching cranially on the tibia. Now the caudal cruciate will be really difficult to see on this, but it will be extending caudally and inserting caudally on the tibia. So those are the cruciate ligaments there.